Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Satchar, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you are in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Today, I'm joined by Justin Chang, MPH, as the Director of Education at Project Unity and Director of Catalyst Academy. Justin is advancing youth-centered public health education and building systems that reflect the communities they serve. He earned his degree in neuroscience from UCLA, completed his MPH at George Washington University, and is now a medical student there. We're thrilled to have him here today to share his journey and his vision for reimagining public health from the ground up. So hi, Justin. Thank you for joining us today. Where are you joining us from?
Hello, everyone. It's so great to be able to talk to everybody. I'm joining from Danville, California, which is actually where I grew up. So it's really nice to be back home and be able to do this episode with you over here.
That's awesome. Thank you for sharing. So let's begin our discussion by talking a little bit about your personal journey and your path into public health. Was there ever a defining moment for you that first drew you towards health equity or youth-focused work?
Yeah, definitely. So I think for me personally, there wasn't really a defining moment. I think I guess you could kind of say the COVID-19 pandemic when it first started was maybe a quote unquote moment. Growing up, I had always been really interested in pursuing a career in healthcare, but I never really got any exposure to public health. So I didn't really know what that meant until the COVID pandemic first emerged. And so that's where my interest in public health and health equity really got started. And then after I graduated from college, I worked as an ABA behavioral therapist, and one of my clients I wasn't able to work with anymore because their insurance fell through. And I think that experience really motivated me and kind of got me to change my perspective a little bit. And, still with that goal of pursuing a healthcare career, but probably having, some more knowledge, filling in those knowledge gaps on public health, health equity, community engagement, and so forth. It's a little bit of a back and forth journey, but I would say that was really what got me interested in wanting to learn more and pursue my education in public health and really understand how public health is integrated into the healthcare system.
Thank you so much for sharing. I'm sure a lot of people can relate. The COVID-19 pandemic really started a lot in terms of understanding healthcare to a deeper level. So let's go further. What experiences shaped your belief in education as a tool for public health transformation?
Yeah, definitely. So I've always been very, very passionate about education and about teaching. You can even trace it back to middle school when I would come home and give my dad Spanish quizzes because I wanted to teach him the things I was learning in Spanish class. But I was always super interested in teaching and mentoring. I believe that by having a mentor, by having a teacher there to guide you through your process of career empowerment and exploration, that, you will truly bring out the best in somebody. And so a lot of those experiences, I got involved in a lot of those kind of mentoring and teaching opportunities, and specifically also tutoring, especially online tutoring. I had joined a couple of organizations that focus on providing online tutoring for underrepresented individuals with lower income, especially during the pandemic when, in-person resources were constrained and were not accessible to a lot of these students. So that's where a lot of my focus really started out at first, and then kind of realizing that, hey, tutoring is not just about teaching the subject, teaching the material, but it's also about empowering the individual to do what they want to do, to explore the opportunities that they want to explore. And I should be there as a resource. I should be there as a guiding source for them to, to give them the opportunity to explore whatever it is they want to do. So I think that was kind of my journey of how I kind of switched from a more like tutoring perspective to more like mentorship and leadership kind of perspective.
That's awesome. I know I can imagine that you were excelling at tutoring because you're doing great as a mentor. The Catalyst Academy has already impacted so many students here at Project Unity. So, what inspired you to join and grow this program at Project Unity?
Yeah, definitely. So I saw Catalyst for the first time in March 2024 through my MPH like director email kind of thing. And it just seemed like a really, really amazing opportunity. Growing up, as I mentioned earlier, I didn't have any exposure to public health. I didn't really know what that meant. I didn't know what prevention, like community engagement, I didn't know what those really entailed. So for me, I saw it as an opportunity to be able to give back and really say, hey, I wish I had these opportunities, so let's make sure you have these opportunities as well as a high school student. And so I think that's what really jumped out to me. And it was also an opportunity for me to teach about public health, which at that point, I was almost done with my master's when I first applied to Catalyst. So it was just a really great way for me to integrate all of my knowledge I was currently learning, because I was learning so much while I was doing my program, that it was just a really great way for me to synthesize that and be able to communicate it in a way that would allow youth to feel empowered and to grow their leadership skills as well. So that's what really drew me to Catalyst and why I'm still here today.
That's incredible. I love the way that you said that you want to give back to a community that doesn't necessarily have those opportunities. I'm sure a lot of people can relate. I feel like public health is not as emphasized as we really want it to be. So hopefully that's how we can shape our future of healthcare as well, by having these conversations and focusing on these topics. So let's dive right in. You mentioned that you worked within programs that are both community driven and system informed. So from your perspective, what's a part of public health that still feels stuck in the past?
Yeah, for sure. I think there's definitely a lot of things to choose from in terms of, what public health, where do we feel like it's stuck in the past? I think for me, the biggest thing always just comes back down to prevention. I think there's lots of emphasis, and the public health landscape generally has been getting better at emphasizing prevention. But I think for me personally, like that's always something that we can continue to improve on. Encouraging individuals to get screening for, certain cancers, encouraging everyone to get vaccinations for, certain, to prevent, severe disease of, certain illnesses. I think for me, that's something that, always can be improved upon. I think we live in a place where things are very much medicalized and conditions are medicalized. And so you kind of just go to pharmacology as like the main kind of source to treat a condition or disease. When, in reality, there's lots of different ways in which, if we are able to improve the infrastructure. One of my biggest passions is about walkable areas and about clean areas and public parks, right? Increasing the amount of green space we have can promote exercise. It can promote healthier air quality, and improving those conditions can lead to a decrease in so many different kinds of diseases. And so I think a lot of the times we feel like we have to medicalize and we have to treat pharmacologically, when there's definitely a lot of behavioral interventions, a lot of system level interventions that we can implement on a greater level to integrate more primary prevention of disease. So I think that's always something that we can continue to improve on in the public health world. And then in addition to, I think this just goes back to our mission of Catalyst Academy, is really just that value of youth empowerment. Adolescents, youth, they know so much these days. They know so much more than when I was a youth myself. And so I feel like if we can leverage those knowledge and leverage their skills, we can lead to more sustainable, more community driven interventions, because I am over here in Danville, California, but I have no idea what the communities in, the Midwest are like, for instance. And so I think by being able to continue to empower individuals, youth, and adults likewise in a public health setting, and how can we inspire them to be public health leaders, is something that, we can definitely look forward to and hopefully improve in the future of public health.
Some answer, 100%. I resonated with everything that you stated as well. And that was a perfect segue into our next question. You mentioned how youth are super involved and they have so much knowledge and so much to offer. So what are some overlooked barriers you think that youth face when trying to access opportunities in healthcare and medicine?
Yeah, definitely. So I think, again, this is one of the reasons why, Catalyst Academy exists and why, I'm so passionate about this organization. is really that, one of the biggest barriers I feel is just access to, fundamental public health knowledge. I think there's definitely opportunities out there to engage in hospital volunteering, for youth, or being able to shadow, even, if those opportunities do exist. But I think one of the biggest problems is that exposes, youth to the medical side, the medical perspective of things, but not to the public health perspective. And, I was someone who I engaged in a, hospital internship, but I mostly learned about things that go on in a hospital. I didn't really learn about the system in which this hospital was situated in my community. So I think one of the biggest barriers is just the fact that there are no sources or no resources to uplift students to learn about the healthcare system as a whole. There's definitely ways in which you can learn about what a doctor does, what a nurse does, what a healthcare worker does, but not necessarily how they fit into the healthcare system as a whole. So I think that's definitely something that can perhaps limit someone's knowledge in terms of what healthcare can be. It's certainly limited mine. And it took, it took a few years before I actually opened my eyes to all of this. So I think definitely, and I think that leads into something else as well, which is just, earlier exposure to, sensitive and difficult topics like public health. I think especially in high school curriculum, there's a lot of emphasis on biology, chemistry, right? But there's not really that big of an emphasis on public health as like a subject to be offered in schools. And so I think that also limits students. For some students, going to the public school might be their primary source of education. There are some communities in some areas may not have the resources to enroll students in, secondary programs. And so I think that's also something too, is just access to those educational opportunities for youth to really put together what they're seeing and what they're experiencing into actual words, and then hopefully later future action.
And we can see why you're so passionate about Catalyst. I mean, Catalyst helps overcome these barriers that youth often face as well when trying to gain access and opportunity to public health. So how do you really build programs like Catalyst that don't just educate youth, but they empower youth to continue with this mission and this journey moving forward?
Yeah, definitely. I can definitely speak a little bit about that. I think for me, one of the biggest things that I've learned, just being director of education this past year, is that, we are Catalyst Academy. We are a program dedicated to teaching the fundamental public health. And we've built out, an excellent curriculum. At least I hope it's an excellent curriculum that really emphasizes, those fundamentals and those basics that, all of us directors wish we had when we were in high school. But I think one thing that makes Catalyst really stand out is our emphasis on teaching youth and teaching this group of population, the value of soft skills. I think soft skills is something that is not generally taught explicitly, right? We don't, in high school, I was never given a class on time management. I was never given a class on how to organize. I was never given a class on how to problem solve. Those kinds of activities were not really something that was emphasized a lot. But by, giving students creative liberty to pursue a research project of their choosing, by allowing students the opportunity to pursue a topic that they are interested in, by giving them that agency, I think that really allows us to open the doors and help them teach, these soft skills, whether or not it be public speaking, whether or not it be, time management. Like, you have this topic that you're really interested in. So let's really break it down in steps and see how you can complete it in a reasonable amount of time. So I think that's what makes Catalyst really special, in my opinion, is that, these students who are participating in the program, they really get the chance to build those leadership skills and build those development skills while exploring an area of interest. And I think that just inspires them more and more to be advocates about the topic that they want to pursue and write about. And I think ultimately that leads to really, really strong youth empowerment. So I think that's what makes Catalyst itself incredibly special and unique.
Like you said, all of us wish that we had that during high school. Definitely me as well. I know that public health is something that is super, super important for us to discuss, and these soft skills that go along with it, especially time management. As college students, I feel like it's just a big get hit like a truck and you're expected to do a lot of things on your own. So 100% agree with what you said. And we can see that empowering young people isn't just a value at Project Unity. It's honestly built into the infrastructure through the diverse amount of programs that we have through Catalyst Academy and empowering our youth. So, what do you think that adults often misunderstand about youth capacity in public health? I know we have so many programs here empowering our youth, but what is the barrier that we're trying to cross in terms of what is misunderstood?
Yeah, for sure. And I think that's a really, really wonderful question. I think, in my opinion, probably one of the biggest things is just, perhaps adults may not necessarily, understand that these students are incredibly passionate, right? They are so very much, willing to put themselves out there, engage in the work to actually lead to, youth empowerment and to lead to better health outcomes. So I think, like there's always no harm in, sitting down with youth and just listening to what they have to say, right? Listening to their concerns in their community, right? As adults, I think sometimes we feel like, and I feel like I've caught myself on this a few times myself, actually. So it's something I'm still growing in, but just being like, hey, tell me what you know, or tell me what you've learned, and letting them tell you about their experience in their community, or letting them tell you about how their experience in the program is. And then after they tell you all that, then going in and being like, well, here are, some suggestions about whatever it is, or here's what I'm hearing from listening to you speak, right? Just actively listening to them and reflecting upon what they're saying, instead of feeling like we need to jump to the solution right away, or instead of feeling like we know what's best for the students or best for the communities the students are in, so we are just going to place these recommendations. Instead, creating a project where students are really able to guide, right? And being the main leaders of the project, really saying, hey, you guys are going to be leading this project and I will be there as your support, and I can give you, knowledge and education along the way if you feel like you need it. So I think that's really something that I feel is really, really important. Always as adults, just like checking ourselves and being like, when am I becoming a little bit too patronizing, let's say? Or when am I feeling like I'm just kind of giving them the answers, or I'm telling them what to do, and taking a step back and being like, let me see what they have to offer me. And then we can engage in that bi-directional discussion from there. So I think a lot of times it's more so like, okay, you need to do that, you need to do that. And that's kind of how the society has been built, right? Like, oh, you need to do your college applications, you need to get this opportunity, you need to do volunteering. And so, I don't think it's anyone's fault per se, but I think a lot of the times we should also step back and take some times to reflect ourselves of, what does the student want? What does the youth want in that moment? And let's see how we can best support them.
Awesome answer. I 100% agree with that as well. So you mentioned that meaningful youth leadership is so important. And we want to ask you that you've mentored dozens of students through Unity and Catalyst. So what does meaningful youth leadership actually look like in practice? What are some things that you've seen, and what are some things that you would love to share about this?
Yeah, for sure. And I think, meaningful youth leadership to me comes in many, many different forms, right? It is not just about, being that person who's like the main like leader of like a project and is like the one, everyone is talking to, right? Like that's obviously one component of leadership, but I think leadership can come in many different forms. It can come in the form of, offering someone to collaborate with you. In Catalyst Academy, we have 5 incredible youth interns who are willing to put themselves out there and really engage with our Catalyst Academy students, and offer their experiences, because they were all alums of Catalyst last year. So really offering their experiences to the students of what Catalyst was like, what they found really rewarding, what they found challenging in Catalyst, what they found hard in Catalyst, right? That to me is also leadership. It's the willingness to be able to give your perspective, give your opinions, and to not be shy about that, and to say, hey, this is me just offering my raw experiences, and if you have any questions, I'm happy to answer them. Just being that support along the way, that to me is really, really meaningful youth leadership. And then I can just give one more example of what I feel like is like a unique example of youth leadership, which is really just having initiative. So having that initiative and drive to be able to say, hey, let me just start this project. Let me even just ask this person something that I want help with and get the answers that I need. I'll give you an example. If the person listening to this is listening to it, then hello. But I had a student last year in Catalyst Academy, and that student, really was engaged with the material, really was engaged with, me and also all of the other mentors in Catalyst Academy. And they reached out to me, I think in October or so, because they were applying to colleges and wanted help with their college applications. And so we met on Zoom. We talked a little bit about their college applications, their UC applications. Mm-hmm. And then after that, I gave them edits, they did those edits. And throughout that entire process, they were very, very vocal in asking me questions and taking that initiative and saying, hey, I don't know this, or hey, I want some help with this. Can you help me? And then fast forward to around March or so, I hear back from them again. And they're like, yeah, I got into UCLA. I want to hear what your college experience is like. And so we got on Zoom and we talked again for an hour and a half. About UCLA, about my own experience, in college and all of that stuff. And so to me, it may not seem like a clear-cut example of leadership, but to me, it's really that process of taking that initiative, being able to put yourself out there and say, evaluate what you know and what you don't know, and have the drive and push yourself to fill in those knowledge gaps. It will be uncomfortable. It will be a process that, if you feel like you're entering uncharted territory, but if you have that drive to continuously improve yourself, that to me is leadership, and it translates into being able to inspire other youth as well.
Yes, that's amazing. And you did touch on this when you discussed the various forms of getting involved in youth leadership. So what advice would you give to a young person who wants to lead change and doesn't know where to start? I know you talked about taking initiative and just asking questions. Is there anything else you want to close off on students who are super, super interested in leading and starting change?
Yeah, definitely. I think I'll probably just re-emphasize and continue to emphasize this message. But honestly, if you see any opportunity, try it no matter what. Mm-hmm. If you're even the slightest bit interested in pursuing something, then go for it. Then, don't, because the worst thing that can happen is that you don't get that opportunity, or that the opportunity maybe doesn't work out. But at least you can say you tried, right? And when you say you can try, that means there's things you've learned from that experience. And so really taking that time to reflect and being, maybe the opportunity didn't work out, but what could I have improved on that I might take into the next experience with me? Every single experience that you have and that you undergo, those are all incredible learning opportunities. So no matter what, no matter how far off something is, if you feel like there's no way in the world that this will pan out for me, or it's this is such a this is such a prestigious thing, there's no way I'm gonna get it. It's hard to avoid that mindset, but I really encourage, all of you to really just go for it, because you never know what's going to happen. You will never know. It's like that quote from somewhere that I don't know, but it's you never know what's going to happen until you try it out. So really just, don't be afraid. Just try that opportunity. And if it doesn't work out, that's okay, because that's, again, another time to reflect, another learning opportunity for you. And I think especially, youth have lots of really, really fantastic ideas. I think just being able to find an opportunity and applying to many different opportunities, seeking out many different chances for you to apply your knowledge, is what's going to get you to get that chance and get that opportunity to really lead meaningful change.
Awesome. That's incredible advice. And on talking about reflection, let's close with some personal reflection questions as well. So what's a belief that you recently reevaluated in your work or your approach in terms of public health?
Ooh, yeah, that's a really, really great question. I feel like I'm constantly reevaluating myself in terms of public health and medicine and how, those should be integrated together. I think for me personally, one thing that I've really kind of realized, and this is just me, having gone through 1 year of medical school so far, is again, just me constantly reflecting and being like, okay, I'm learning about this disease and I'm learning about all its characteristics and how to treat it and how to manage it. But I can't forget about the public health component of the disease. I need to make sure I'm constantly checking myself and saying, what exactly are the public health implications of it? How can I prevent the disease from a public health perspective? Or if I can't prevent the disease from a public health perspective, how can I still use public health to minimize the severity of a disease? Or how can I use public health to reduce the number of complications that a patient may face during the course of the disease? So I think for me, that's been a really big belief that I've constantly needed to recheck myself even. And I think it's very important. I think it can be very easy, especially if you want to go into a healthcare career. Like I took a pause on my healthcare career to pursue my master's in public health, and now I'm starting back up that healthcare career of mine. But even still, I feel like I've fallen into that trap where I'm just memorizing or I'm just taking in disease after disease after disease, but not necessarily saying, what can that look like from a policy perspective? Or how can we improve it from a community perspective? Really taking that time to actually think about all of that. I think that's something that I've had to constantly, think about throughout the course of my public health journey. And then also just again, constantly reevaluating my own biases. I think a lot of times in public health, especially, it is very easy to make assumptions about the community. It's very easy to just feel like you know what that community is like. And so you can immediately just provide interventions. Now, for me personally, my parents are from Taiwan and Hong Kong. And so I've always had, a Taiwanese perspective, a Chinese perspective on a lot of health issues. But the Asian community is so many different ethnicities. It's such a rich community that every single community has its own cultural beliefs, its own sociocultural views. And I think there have been some times where I have projected my own cultural views and beliefs, and that hasn't necessarily, agreed with, the individual I'm talking to, or that it just wasn't something where I was being fully cognizant of the situation at the time. So, constantly reevaluating my own assumptions, my own biases, and working to, employ that value of cultural humility. I think that's something that, in public health is very overlooked. I think going back to one of the earlier questions too, it's not just about cultural competency, because competency implies that you just know the baselines of something, but it's about cultural humility, constantly engaging in that self-reflective process, and really ensuring that you are, staying up to date, whether that is staying up to date or whether that's wanting to learn more so you can help out the best way you can. So I think those are some things in my opinion, in my practice, in my experiences that I definitely feel like I've had to kind of rethink or just add on as I continue to grow on my own personal journey.
Thank you so much for that. That was incredible. And this is a little bit of an overarching question, but what does your one sentence vision for the future of health look like?
I don't know if I can do it in one sentence, but I'll definitely try.
Yeah.
I feel like my vision for public health, kind of going back off of the previous point I was just making, but my vision of public health is a world that, can engage in cultural humility, self-reflection, awareness, and prevention. Really being able to assess what the community assets are like, assess, how what strengths the community has, being able to leverage them. And so that results in a lot of, listening, a lot of really just active listening. I should clarify, to really understand what a community is going through and how can public health come in and help engage with the community.
Thank you. And before we wrap up, I know you mentioned so much throughout this episode, and I'm sure that anybody listening would be so incredibly inspired. But is there a final message that you would like to share with the next generation of public health leaders?
Yeah, definitely. I think honestly, my biggest takeaway, and I know I've hammered home this point a lot, so I won't talk too much about it in more detail here, but honestly, if you have an idea, if you have a topic, if you have a passion that you are incredibly passionate about, take that initiative and go for that opportunity, right? Seek out, opportunities in your specific area. may help support that, right? Or if there is no one, email someone and say, I have this idea, but I don't know who to go to. Can you give me some potential sources, or can you give me some potential contacts, right? And then go from there, right? So constantly, have that drive, have that initiative to lead change, and more importantly, to pursue something that you are passionate about, and to pursue something that you really want to pursue, something that, if you were to say, like, I left my mark on the world and this was it, that found that. So really just explore, learn about a lot of different things, get exposed to a lot of different, platforms. And yeah, those experiences will all lead to, that change and that drive.
Awesome. Thank you, Justin, for sharing your insight and helping us imagine what youth-centered health can look like throughout this episode. We hope that today's conversation sparked reflection and affirmed that youth voices are essential to building a more just, responsive, and innovative health system. So if you're ready to take the next step, visit projectunitynfp.org to connect with other changemakers, explore student-led health initiatives like Catalyst Academy, led by Justin himself, or get involved with future episodes. I'm Hargan Satchar, and on behalf of Project Unity, thank you for listening. See you next time on Call.